Especially when you're a person being mostly at home, you don't get hospital grade care. But I just really missed information and almost education and just like, what should I do? What can I do now? As this completely unprofessional person stepping in and trying to help my mom, what can I do to actually help her now without becoming a nurse? I thought that family members or the loved ones, that they were an untapped resource. And after just like a very long and iterative process, we ended up with what is now kind of an evolution of that, which is PAL, a support tool that helps essentially, especially family members, to just get the information and knowledge and tools and everything that they need so that they can actually be informed throughout the whole care journey, so that they can not only help their family member with more like practical support and anything that needs to be done in daily life, but also so that they could be better advocates for them and get them the help and intervention they need from the healthcare system.
Hey everybody, this week I'm joined by Nara Moripen, the co-founder and CEO of PAL, which is a digital palliative care solution that helps families navigate the world of serious illness, gives them practical tools and support needed to care for their loved ones. So Nara, welcome to the Healthtech Podcast. How are you doing?
Thank you so much. I'm really excited to be here finally.
It's been a while. I actually struggled to find your intro just now, as we were talking about, because you filled the form in April and we're now September. So in startup world, that's like 100 years. So I imagine your company's probably in a completely different place to what it was in April.
We're so close to exit right now.
Oh dear. I mean, that could well actually be true. I'm laughing. That could actually be true. We'll soon find out. So Nara, whereabouts are you speaking to us from? Where are you based?
I'm in Amsterdam right now. It's not the Netherlands is not my home country. I'm originally from Norway, but me and Pal are both based here together with the rest of the team. Yeah.
Lovely. Beautiful. We were there for Health Europe not long ago. Yeah, beautiful city. But yeah, listen, absolute pleasure to have you on. I think it's a really interesting space to obviously make impact, obviously solve a problem for so many people, but certainly an interesting one to grow a business and obviously choosing to structure it that way to make impact and all the rest of it. There's so much that we can talk about. Really looking forward to getting into it. But of course, we want to hear your story first of all. So obviously I've looked you up. I know a lot of your background. I think it's super interesting for listeners to find this out. So why don't you tell us a bit of your story?
Yeah. So basically, when I was done with high school, I moved to the UK. Actually, lived in London for a few years to study business. Had like a gap year in China after, and then moved to Germany after to do my master's, where I also continued on the same with business and strategy and management. That was like my whole degree, and I was on a very clear path to management consulting. That was kind of what I had set my eyes on and what I would do after.
Why did you set your sights on that out of interest?
Yeah, it's a very good question. First of all, I think it was a bit the environment I was in. Business school, there were a lot of other people who wanted to do it, so it sounded interesting. It was either that or investment banking, which didn't really appeal to me that much. And I also liked the fact that you didn't really have to work on the same thing every day. I didn't really want to get a job where I just had to go and do exactly the same thing every day and never get challenged. So I think I was seeking a bit that highly compensated, challenging job with a lot of variation. That was the initial thing. And I'm also quite competitive, and I think I liked the fact that it wasn't
everyone was going
that
for
easy
it, yeah.
to break into. Yeah, that's something that I've always like strived for a little bit. So after I was done with my master's studies, I ended up getting a job in consulting. So I then started working for the global consulting arm of IQVIA, which is a very large company in the life science and health industry. And they're one of the biggest service and data providers to, for example, the pharma industry. I hadn't actually been that interested in healthcare before, but I just really liked the team. I liked the projects and just had a gut feeling that I should go for that offer. So I did. And then I spent the next, I would say, like 4 or 5 years working my way up to manager and really working with like the largest pharma client or pharma companies in Europe on some like pricing and commercial strategies initially. And then I moved more and more into digital health and especially digital therapeutics that started kind of becoming more and more mainstream while I was still in consulting. So that was sort of my more like official career. Then one day when I was still, of course, a consultant, I went home to Norway to visit my family. And I discovered that my mom was quite sick. She just needed to go to her GP and get some medicine or something. So I accompanied her there. And that just resulted in her immediately getting hospitalized. It was kind of like emergency care. And we very quickly found out that she actually had lung cancer. And not only lung cancer, but a very aggressive form of lung cancer that is called small cell lung cancer. And
so she wasn't even a smoker, just...
Yeah. And we were pretty much informed immediately that it was terminal. They didn't know how much time she had left, maybe 2 years if she was lucky. So that was, of course, this massive, like, changing moment where, of course, me and her and other family members, we immediately had to kind of, think, what do we do now, knowing this information?
Well, I mean, first of all, just on a personal level, like, obviously, sorry to hear that. It's an awful thing to have happen to anybody. And it obviously shakes you up. It shakes your entire life up. My brother got diagnosed with a form of pancreatic cancer as well, and had a very quick end once it was diagnosed too. And so I know that kind of chaos and anguish, and it just puts you in a really interesting space for perspective and so much. And I had a really good look at my career, let's put it, and really reevaluated, what am I doing, what should I be doing, what do I want to do. And it really it's strange to say, but it really helped bring so much clarity in other parts of my life when you go through something where someone like that, a family member has lost their life, and you just sort of all of a sudden feel like this can happen to me, this can happen to anyone else, and what should I be doing? And that question plagued me a little bit. What should I be doing? But what I will say is that, for me anyway, it unlocked a completely different path for me, which I ended up being happier in. What was that period like for you? And I guess what were you taught, or what did you feel in that moment that then helped you in the next phase of everything that you were going through?
First of all, I'm so sorry to hear about your brother. It's horrible, and I can completely relate to what you're saying about it just shaking up your life, and you're not really the same, and things just change in terms of how you value things, and that was the same for me. Like when that happened, it was kind of any then kind of work email that came in. It just seemed so trivial when someone was kind of describing like a work emergency, and I was like, it's just a bunch of people sending emails. Like, it literally doesn't matter. So I kind of went from being this person who would sit in the office until 3 and working on all of these like super important things, and I was still a hard worker, but I just didn't see the urgency, and I just felt like there are so many more important things, and I just like that work stopped giving me any form of it just didn't have any value to me. I just felt like the work I did didn't have any impact anymore. And I think in hindsight, I had probably not really cared that much about impact before. So it really changed me. And of course, in the more like immediate term, I really just needed to figure out how can we now make sure that my mom has a good life the time she has left. How can we make sure that she's getting the support she needs, that she's not in pain, and also that we can maybe make the most of the time that we have left, no matter how much time that is. Because I hadn't really been that close to that form of serious illness before in close family or anything, so I didn't really know what I was walking into. but I just knew that I didn't want, and also my mom didn't want, that we would just waste that time being kind of sad all the time, and that she would be in the hospital all the time. So very quickly, and my mom was amazing at this, that she definitely didn't waste any time just feeling sorry for herself. She was all the time just worried about us, like her kids. And she just wanted us to not really have to struggle. And she just wanted to support us, which is, of course, amazing. But the fact that she was willing to talk about it and really talk about the things that she wanted and how she didn't want to just be in a hospital. She wanted to be at home, and she wanted to feel as good as possible. And she wanted to spend time with us and her friends and other people she cared about. I think that really directed a lot, like the decisions we then made over the next year while we still had her. So after some time, luckily, like my sister was living in the same town as my mom. So in the beginning, she was really helping out a lot as my mom got some chemo, which was just kind of life extending and just purely palliative in nature. And then after a while, probably after like 6 months, I moved back home to Norway. After a while, I also took some leave from work so that I could just focus on helping her. And I think I can talk about all the mistakes we made and all the things that I really didn't do well, because that's also the whole inspiration for PAL, the fact that I had no idea what I was doing. But I really do think because we were so deliberate about just wanting to make sure that she was doing as good as she could so that we could have quality time together. I think that really, that was just like the priority, and that did help because we were able to have all the conversations we needed. We laughed, we cried, we looked at photo albums, like we did all the things that we should be doing. And we didn't spend too much time in the hospital, kind of wasting time there. And that was like the main priority for us. And then, of course, after she passed away, then my career was also never the same again, because I had just changed my whole perspective.
Yeah, absolutely.
For sure. Yeah.
Absolutely. In that period after the diagnosis, what support was there and what guidance was there about how to even exist in that 2 years? You mentioned conversations that you're glad you had, moments that you're glad you had, you laughed, you cried, you did all these things that clearly you hold as important memories. And I know, obviously, from a medicine perspective, having obviously experienced palliative care from that side of the table, I know that there's obviously medical support systems, but having some insight to the other side as well, it's far more holistic support that you need as well, and especially close family and that kind of thing. And I'm just interested in your experience there, because of what you said, that there's things that you did right, there's things that you did wrong, but clearly you identified a need here that existed as you were going through it. So firstly, what does that support system look like?
So the first thing that actually happened when my mom received like her terminal diagnosis was that we actually got a referral to the local palliative care team immediately. And that is like the first thing that happened that was done right. And like, just reflecting back, I'm just so grateful for that referral, because it just made us aware of that type of holistic support and needs that you mentioned. And I think maybe normally without that referral, I would have been way more on the like, let's fight this. Let's try everything. Let's fly you out to, the US. Like, let's just do everything we can to get you treatment, and let's just extend your life, and let's just hope for the best. And I think that just the conversations we could have as a result of that early referral to the palliative care team, which, by the way, I think we got very lucky. It's not in every healthcare system. It's not in every, for every family, even in healthcare systems that technically have that you should get a referral to your palliative care team early. Quite often that's not really the case, which I could talk for hours about why that is wrong and why it's so important to have the conversation early. But really it helped us because it made us aware that the life that she would go on to live now it wasn't only about time, it was more about quality. And that as a result, we should have conversations around, should we now just try to pursue any treatment that will be life extending, but not consider quality of life, not consider side effects of treatment, not consider all of these other things. And also without having a conversation with my mom about what is her priority right now and what is our priority as a family. And all thanks to that early referral, we had all of these conversations. It also helped that my mom was super open and she wanted to have these conversations. But as a result, we then agreed as a family that the most important was not trying to like squeeze out as many years as possible, but to try to find a bit of a middle ground where she would feel as good as possible. And then we should just enjoy the time we had. And there were still some treatments that we ended up saying yes to that in hindsight, I maybe think we should have said no to, because it's just not easy knowing that, how you will react and what might happen. But in general, I think just the biggest thing that I took away from that is that it's just so important to be aware that it is a conversation that you should have, and you should not just say yes to any treatment just because on paper it might extend your life by, let's say, 3 months. So, yeah.
There's a huge burden placed on families, isn't there, with regard to these types of decisions when you're not medical, you can't be fully informed on so much of this, and yet you're shown a list of advantages, disadvantages, side effects, complications, risks, percentages, this, that, and the other, and you're just sort of told to make a decision. And of course you're kind of putting your trust in a proxy there, maybe, of like, how is that person saying this? Are they trying to push me in one direction or the other? Can I ask what they would do in my position? And if you do, they can be quite cagey, because I've been in those situations as well. And it's a real burden that I guess you're sort of looking for something there that obviously you've since put into the world, this kind of trusted entity that at least is a companion through the whole process. But I guess it is that, isn't it, that you're not sure who to turn to, if I'm reading that correctly, and you're unsure of these decisions, and you certainly don't want to live with regret. And I don't know what you think about where we are as a society with our conversations around palliative care and death. You're obviously a lot closer to this now with things that you've been doing with PAL since, but my feeling working on intensive care is that we're always fighting this human instinct, or call it a Western world human instinct of alive longer is better, end of story, unless it's an extreme case. It's alive longer is better. And that narrative, I found it really difficult. Just my nature in intensive care, asking so many questions and being relatively philosophical in my thinking and all the rest of it, and well-read on, or you can't be that well-read on consciousness, but relatively well-read on consciousness, given that I manipulated it for a living. But I don't feel that we're that well-equipped in the world right now to be talking about these things, and they are so uncomfortable, and we're leaning towards a life longer is better at all times, and it's like a constant effort to think differently from that. But I don't know, is that your experience? Was that your experience? How do you feel about that?
Yeah, 1,000%. And of course, it's great to live long if you're super healthy and happy and you have no pain and all of these things. Of course, that's great. But I think it's such a big problem that people are also so scared of talking about these things. And I'm
scared now, by the way. Like I'm concerned now how all of this is going to be perceived, and all the rest of it. It is uncomfortable. You're absolutely right.
Yeah. But I think that's also a bit of a challenge when you're then finding yourself in a position where you are having to talk about this. And when there are so many misconceptions as a result, it's difficult for people. And we struggled with that as well. It was not something I was used to. So I remember at some point we discovered that my mom had been flagged as like that if she were to get like picked up by an ambulance or anything, that she had like a DNR tag, which meant that she could not be resuscitated if something were to happen. And now in hindsight, with the information I know now, I know that at the time that happened, that was the right decision, because that would have completely ruined our whole priority of getting her the best care and trying to optimize her quality of life. But at the time, I just remember I was getting so upset because it just felt like my mom wasn't cared for in the way she should be. But that wasn't really the problem. The problem was that we as a family, uneducated when it comes to medical aspects, we just didn't really get the right information, and we just weren't educated on that. And that is the problem when there's a lot of stigma and kind of people are scared of having these conversations. And yeah, I think that needs to change. And that is also part of what we are trying to do with PAL. We're trying to also make it clear that palliative care or any form of holistic care that you would benefit from when you're in this type of situation, that is not only reserved for the final few weeks of your life. That is something that you can really benefit from when you find out that you're seriously ill. But unfortunately, there is so much stigma and people are scared of talking about it sometimes. And yeah, I would love to like change that if possible.
You mentioned stigma, and I think there's so much attached to that word that it really is a barrier to what might well be the most important part of this and the impact that we can have in this conversation, which is people talking to each other. And I also think the stigma element really hurts family members that have to make decisions. Like I really do, because you can see the anguish in people's face. You mentioned a DNR, really interesting, because I used to be part of a lot of these conversations as a doctor, and I was only a doctor for 5 years. I was still technically classed as a junior doctor, but I saw my fair share of these conversations, and it's just never easy. And people don't know what it actually means. You're absolutely right. And it's like, oh, you're not going to try anymore then? It's like, no. That's absolutely not what it is. But that's a completely fair and reasonable, by the way, conclusion to come to if your healthcare system is saying, once this happens, we're not going to do, once X happens, we're not going to do Y. Like, it's completely reasonable to say, well, okay, well, you just got to. So, and there are all of these things, but the actual decision around that is really stigmatized. I can remember even my mum talking about this when her mum broke her hip, pneumonia, like a very classic story. And again, anguish that they have seemingly like a decision is being made by that person and not medically, not equipped to deal with that from a medical perspective, but also just philosophically and emotionally and on a very human level. It's almost like you're the one now saying that person doesn't get to another shot or whatever at life. And I think there's so much work to do here. I really do. I think there is an infinite amount of work to do here. It feels like we're at the bottom of a very, very, very large mountain to climb, to start asking questions like, is alive longer better? And should we really just be reserving this to extreme cases, or is there a conversation about lots of other things with chronic illness and cancers and decline and acute injury followed by a life that you might not want, and quality of life? What does that really mean to the individual and families? And like, I just think that, I remember asking my dad recently. My dad was so he was a nurse. He worked in mental health. He worked in cardiology. He worked his way up and got into management and did various bits and bobs in management, all the rest of it. But obviously worked clinically for so much of his life and career. And he's in his 80s now. And I remember asking him, we were in France a few years ago on like a little holiday, and I remember asking him like, what would you want in this, that, and the other scenario? And even he just didn't want to talk about it. He was just like, no, made it very clear to me that he did not want to talk about this stuff, even though you would expect to be one of the most comfortable talking about this, as one of the most informed people to talk about this. Having worked on a cardiology ward, I mean, will have seen his fair share of various different things, lives he wanted, lives he wouldn't want, and you'd expect him to like give me some direction on this sort of stuff. But even he didn't want to talk about this stuff. And so, yeah, it's fascinating to me how underprepared I think we are in our culture to talk about this stuff, and in a world where so much money is spent on the last year of life and all these different things from a systems point of view. I think there's many an argument that we can improve the quality of life of so many people by talking.
Yeah, and having conversation around it, and also just making sure that people do get the proper care that is focused more on quality of life. There's even research that shows that in some cases that can even prolong the life. And it certainly can help people actually be able to stay at home for longer without getting hospitalized. And I would certainly rather want to spend a month at home than a month in the hospital. So yeah, there's so many things around that. And you also mentioned, the example with, for example, your dad, and trying to have this conversation, and when people are not feeling comfortable talking about it, which I can fully understand. I was not comfortable talking about these
Of
things
course.
a few years either, but I do think what was this thing that I really recognized when my mom got ill was how much responsibility then falls on family members. So that is both when it comes to these conversations. Like if you're ever in a situation where your loved one who's sick cannot make these decisions themselves, of course, then the family members need to make them. And it's extremely hard, and it's a big burden when you haven't had that conversation.
Huge
You
burden.
then don't really know what they would have wanted you to pick as their advocate, right? And there's also a lot of other things you need to do in that situation as a loved one to make sure that you can advocate for them and that they get the best kind of care. And it really can change a lot if you know what they value and what is important to them. That really changes how you can behave as a good support system for them as well.
Having been through, before we move on to the sort of tech element, and obviously you've learned a lot that you've then used to essentially start building a company to address some of these big issues. But before we move on, just a really short, I guess, I just want to touch on this really briefly, and just ask you the question that for those people listening that will not have given this a second thought previously because they won't have had a loved one in any sort of palliative care setting. Their grandparents might still be alive, like they've not had to deal with any kind of big family event in that setting or anything along those lines. But we all get older, and this death and taxes, etc. It's coming for everyone, like ultimately, and it will happen to all of our parents at some point, if not already. What would your advice be, given what you went through and the sort of speed that it all happened? I guess, is there a conversation that you would advise everybody have?
Yeah, for sure. And I know it can be extremely hard to have these conversations, and you need to find like the right time to do it. But it is so important to also just make it, if I would have to go through this again, you need to explain to your loved one that it's very important for you to know these things, and you can take it at like their speed, and talk about the things that they're comfortable with. But it is so important to get a feel for what their priorities are, and whether that has to do with, are there certain things that they really want to do, what matters to them in terms of the people they have around them, where do they want to be, like just throughout the whole journey that you're on. Like all of these things are so important. It's not necessarily that you need to have a conversation around DNR initially. I also wouldn't have had a conversation with my mom around that in the beginning, around the time of her diagnosis. But what mattered the most that she actually initiated, which I was so grateful for, was that she told us that her priority was to be able to be at home, and that her life should just continue to be as close as possible to what it was. And then the disease and kind of her interaction with the healthcare system would kind of just have to fit into that life. But that was, of course, only possible if we made sure that she got proper care, so that she wouldn't have to be sent in and out of the hospital, because all of these complications and things happen. But we really knew that this was her priority. So then we could really try to be aware of what could be the things that could kind of potentially risk this and send her to the hospital. And we just worked so hard on like trying to not make that happen. And in the end, like she was able to stay at home, and all of these things worked. And I don't think I would have known that that was her priority. I think maybe I would have thought she wants to live as long as possible, because that would have been my priority right now, like, or before this. So just try to have a conversation and just really understand what really matters to them. And it might surprise you, right, from what you think. And that doesn't have to be a sad conversation. You can keep it like, just it's about their priorities and what really matters to them.
Yeah, and what parts of life that they would prioritize in those moments.
Yeah.
Absolutely.
Yeah.
Thank you for sharing that, Nara. I know that it's not easy. It's not easy sharing that stuff, and it's certainly not easy sharing it in the detail that you have. But I think there will be at least one person that listens to this that will now have a conversation with someone that they love and care about. And so I think that is, of course, a massive win. So I really appreciate you going into that detail. And as I say, I know it's not easy to do so. So with what you learnt, what in that period, I guess my question is what happened next? And I guess not to gloss over anything here, if there's anything important that you want to tell in that period afterwards, but how did all of this lead to what is now PAL?
So, I mean, after my mom then passed away, a little over a year after that initial diagnosis, I did like reflect back on that whole period. And I think I wouldn't say I was traumatized, but I was just a bit, so I did end up having to take on a lot of responsibility. And that doesn't mean that the healthcare system that supported us and the nurses and the doctors, they were fantastic. This whole reflection had nothing to do with them, but it's more the way the system is set up, that especially when you're a person being mostly at home, you don't get hospital grade care. That is obvious, right, to everyone. But I think that I always assume that when someone is very seriously ill, that you would just have kind of round the clock care and everyone would come, and like the most important thing would of course be my mom and caring for her. So it did surprise me a bit that there was a bit of a disconnect when she left the hospital after that initial diagnosis. And then it was kind of just like, yeah, kind of just give us a call when shit hits the fan and something bad happens. And that was just not something I could ever get behind, because I didn't want my mom to escalate in any way. I wanted her to be stable. I never wanted her to be in pain. And so I did, of course, spend a lot of effort trying to be almost like a watchdog and care for her and try to alert, her doctors and nurses and everything when things happen. But I was not a doctor. I have no idea what to look out for, right? So I was a bit kind of puzzled by that whole, how it was so reactive and not proactive in any way. And I was informed by, the system that if you want your mom to be at home, then, there is a big reliance of you and other family members. You need to step in and help her. And we did all of that gladly, and I would do it again in a heartbeat. But I just really missed information and almost education and just like, what should I do? What can I do now as this completely unprofessional person stepping in and trying to help my mom? What can I do to actually help her now without becoming a nurse? So that was sort of my whole reflection after that. Like, we made every mistake in the book. A mistake I made sent my mom to the hospital because I just had no idea what should be done in that situation. And I didn't always know when to alert the doctor and everything. But also so many things we did really great. And we learned also to recognize things in her. So I really just recognized also, of course, the power of the family and other friends and loved ones in that situation. And I don't think, I believe them when they said that without us, she wouldn't have been able to stay at home. Anyway, so that was like my main reflection. And then I kind of went on with my life, after a very long period where you actually have been stepping out of your own life. I did have a big need to kind of just return and just try to pretend like things were normal. And of course they weren't, but also many things were completely normal. So I went back to work, started working again for the same clients. And, things were actually pretty okay. It wasn't really a big problem. But essentially then for the next 9 months, I guess, I was then still left with this feeling that I just feel like my life changed, but now I'm sitting here kind of back in my old life. And especially career-wise, I just feel like this is not the thing for me anymore. And then I decided to take some time off again, but this time not to be a caregiver, but to kind of just explore a bit in terms of entrepreneurship. What should I do? And initially, I wasn't really thinking of doing anything related to what I had experienced. I did want to do something in digital health or digital therapeutics because that was related to my career. But I kind of didn't really have any concrete ideas, and I just wanted to explore. And then just through pure luck, I met my now co-founder. And she also was looking for kind of a project and, wanted to start something. She had worked in startups her whole career and was now sort of looking to start something for herself. And we started becoming a bit friends, and just on the search for different things to do, I just confided in her about kind of my my experience and having lost my mom and that experience as a caregiver to her and how that had impacted me. And as we continued talking, it was like we both just got the idea for PAL, essentially. Because she knew, from her tech startup background, she knew how to actually start this from scratch. And I had more the idea and the experience and knew more about like the regulatory framework and all of these things that are also relevant. But I had no idea where to begin. So she was kind of the one that knew like, no, this is where we start from zero and take it from there. So that was just pure luck. Yeah.
Amazing. What was the initial idea then? Obviously, things can look one way in the idea stage, and then bringing them into reality and going from 0 to 1, things can end up looking slightly different. But what was the idea initially?
So, I mean, the idea, the kind of like main hypothesis that I brought into this was more that I thought that family members or the loved ones, that they were an untapped resource, because that was my main kind of reflection.
For care or
Yes,
for information and okay, fine.
No, yeah, just in terms of like their role that they can play, which is very multifaceted and needs to be kind of holistic, right?
Yeah.
But I didn't really have a concrete idea of how we would make that happen and what a tech solution would look like.
Yeah.
So actually we decided to kind of just start from scratch and just try to kind of not, use my bias and my kind of like preconceived notions of what would work. And we just started from scratch by talking and interviewing so many individuals that were sick and their family members, and also people who had been carers in the past, like me, and had lost someone. And of course, also nurses, palliative care doctors, GPs, and other more like representatives of the healthcare system. And we just started talking to them and really understanding what are all the problems. And we just went like full crazy on all of these problems, designed like different solutions based on each of the problems and so on. And after just like a very long and iterative process, we ended up with what is now kind of an evolution of that, which is PAL, which is like, it's supposed to be a support tool that helps essentially, especially family members, to just get the information and knowledge and tools and everything that they need so that they can actually be informed throughout the whole care journey, so that they can not only help their family member with more like practical support and anything that needs to be done in daily life, but also so that they could be better advocates for them and get them the help and intervention they need from the healthcare system, so that you don't no longer have this like black box that is the home environment, where the second the patient leaves the hospital or the GP's office or wherever they are receiving care, then they just don't hear from anyone anymore, and their doctors and nurses have no idea what's going on. So the whole point is that we are now using the family members, we're making them better carers, so that they can any hour that they want to spend on their loved one, they can actually spend that more efficiently. But also that we're using their observations and what they see, we're helping them to observe the patient better, so that they can report that more in a timely manner to the healthcare team.
It's an incredible idea and incredible product, because just talking about the problem for a second, you mentioned this surprise that you had at the reactive nature of a loved one with a terminal illness being sent home, not being sent home and discharged, but obviously wanting to be at home and choosing to be at home, but therefore having no monitoring, no skilled healthcare professionals around them, and therefore, first principles, smart, intuitive people, yourselves, then realizing, hold on a minute, there's going to be a period of decline that I won't be able to spot, resulting in something that might have been preventable and reversible. Therefore, where is that information and why doesn't it exist? I think it's a really interesting place to start, because I think that the speed that technology has developed in the sort of wearables space and health tech that the general public just wear, to optimize their health, their Fitbits, their Whoops, their all of these types of things that the public now are very aware that wearables and remote monitoring is a thing. And that's been for a fair few years now. That's been for quite a long time. And I think it's a reasonable amount of time for people like yourself to turn around and say, hold on a minute, why can't we create what we're basically talking about, like a virtual ward setting at home to predict decline? Why should my loved one have to suffer? And I think it's a really fair and valid question. And I think it's a failure of our healthcare system that we're not keeping up at any speed. And in fact, the sort of rest of the world, in inverted commas, is pulling away from healthcare, I would argue, in terms of the speed that technology is developing and being implemented and adopted in other areas of people's lives. And so it's becoming, I think, a very legitimate bottom-up pressure from the public saying, why isn't X in healthcare, where X is completely valid and reasonable technology that's used in literally every other part of their lives? And I remember speaking on this podcast, Toby from Entia, which I don't know if it's a company that you're aware of, but they do at-home blood testing for cancer patients that are choosing to be at home. So they have a preventative model for that now. So this type of thing is coming in. But this problem is a really fascinating one. And it's interesting to me that entrepreneurs like yourself then have to step into this to then catalyze the change. But it is, I suppose, it's a good thing that you are and that you can, and that you can create something like this to create that momentum and change and show other people that this is possible, or frankly, to show people that this is actually a problem and this is something that's solvable. This is something that we can do. There's something that you said that I do want to ask you about, actually, which, well, firstly, I'd be interested in your reflections on that. But secondly, there's a part of me that when you say that those families and those loved ones are an untapped resource, there's part of me that has a heart sink moment there that I'm like, oh man, are we really going to be using family as workforce, an unpaid workforce? Are we there? Are we really going to, and by we, I'm putting myself in the general public there, like, are we going to prop up the healthcare system now, like by training family to be unpaid resource? And so there's part of me that is like, oh man, are we there? But I think when taken into full context, it's a group of people that want to help and want to be connected and want to be close. And if we are in a transition period, then I can get comfortable with it from that scenario many times over, because of course, if I'm in that scenario, I'm going to want to do everything that I possibly can. And actually, if it's my choice to have someone at home, then in order to facilitate that, I am going to skill up and train up, because actually I'm going to want to fulfill their wishes to be at home and do everything that I physically can. And I actually don't expect the healthcare system to do literally everything. Of course, I'm going to do what I can. So a constellation of like reflections and I guess emotions there, having, been through something, relatively. So like, yeah, I don't know. What are your thoughts on the problem and I guess that element of family being the resource?
No, you're absolutely right. I'll comment on that first, and then we can also circle back to the first point you made about the whole wards at home and everything. But maybe the word resource is maybe not necessarily the right one, because our vision is not at all that let's push this problem over onto the families that already have enough to struggle with, and let's just not let the healthcare system take responsibility. That is not at all the intention, and also not what the innovation will result in. The main problem that we wanted to solve first is the fact that if the families don't even know how to recognize certain signs of decline or symptoms that are, for example, not cared for in an appropriate way, or if there are just things that they want quickly to get help with or to understand when it comes to like various care tasks that you may or may not want to take responsibility for. Just one example from my own experience, I didn't really want to outsource medication because even when we started getting more like home care support towards the end of my mom's life, because I had already been doing it and I just felt super comfortable, and I either way was like with my mom, and I kind of felt like, oh, it kind of makes sense that I do it when I also give her when we have food together, for example. And there are a lot of people who also don't really necessarily want to outsource everything. Some of these things that you do as a family member who's caring for your loved one, it can also be nice moments together. But the whole point is that when family members are there and they want to help, and they kind of, for various reasons, don't really have access to the type of support that I think wholeheartedly they should be having. But unfortunately, we don't live in an ideal world, and the healthcare system is unfortunately overburdened. And that means that there are so many families out there that are just not getting the support that they deserve and should get. And then I think the alternative would then be to not do anything. And I think that's wrong. So this is more than for the family members that do feel comfortable stepping up, and we then offer them the opportunity to know more what they should be doing in those situations. But also, more importantly, PAL is not meant to push the whole burden over onto these family members. We're meant to give them the knowledge that they need to be able to advocate for their loved one, so that they can alert the healthcare system, whether that is their doctor, nurse, or home care support, or other forms of individual that they're interacting with, so that they can actually get the right support and health intervention for their loved one. Whether that is like pain that is not managed well, or other things, we can educate them and let them know that you should not just sit idly by and let the pain be at an unreasonable level. There are things that can be done. And unfortunately, that is your job often as a family member, that you need to advocate for your loved one. And we are hoping that through actually putting more eyes on the patient, both with measuring various things, but also just through the eyes of the observations of these family members, that then we can bring that information to the healthcare team, and they can actually intervene in the patient's home before anything escalates, and it saves them time, and we can free up beds in the hospital, and there are so many other benefits, right? So prevention, you can have that whole discussion of who should be picking up the bill for it. But I think shouldn't really be a discussion when it comes to prevention in cases like you mentioned with oncology patients at home, or when it comes to people who have a life-limiting illness and are at home. Like, prevention literally saves the healthcare system so much money every year, if they were able to actually just keep these patients at home and keep them stable. And that is more the role that we see the family members play. And I, as you can tell, like, I agree fully. I really don't think that this should be the responsibility of the family. And hopefully we can improve even more things so that they actually get access to all the support that they should be getting.
Yeah, and I don't know, it feels really crass talking about the making a financial argument and a business model argument in such a human scenario, and just such an emotive scenario, and where the individual experience just, I think, counts for so much here. And almost just in like I just don't want this to sound cheesy in any way, but just on a really kind of basic level, it's a part of healthcare that I really struggle with when talking about finances and business model, in that the quality full stop is trumped by saving money, like, quite often. And actually, in this scenario, how much do you value the individual patient experience here? Like, what multiplier does that have? Is it above or below 1 in terms of finances? Do you know what I mean? Like, and that feels very bizarre, and it feels very difficult, and it's really uncomfortable. The thing is, though, in order to make the most impact, you need something that's sustainable. And I mean, you can run things as social enterprise, and you can community. There's lots of different models of setting something up, right? But I'm interested, I guess, in how you see the business model here for you, and I'm interested how you have set this up, and I'm interested, how do you plan to make the most amount of impact possible, acknowledging that there has to be some financial element here too.
Yeah, for sure. And I completely agree.
And I don't want that to be insensitive, by the way, as a question either. Like,
happy to talk about it, and also your point about where do you find the balance between the quality of life and more like cost savings or other aspects in healthcare. I think it's an extremely difficult debate to have, and I know certainly in what direction I'm leaning, where I wish that there were more funds in the healthcare system to prioritize quality of life rather than the impact on the healthcare system. I do think we are in a good spot when it comes to PAL, because all the research points to that when you're actually improving patients' quality of life, and especially when you're intervening in the home setting, it's a very simple calculation when it comes to cost, because you are saving money left and right. It's obvious. Every emergency situation that you can prevent, every hospital visit or admission that you can stop, every case of having to be picked up in an ambulance, any situation where you can provide better care at home,
it's gonna be huge,
and just prevent. There's actually there's no argument against it, because it just makes sense. And there's so much research that is also backing up this claim. So that is all fair. Then, of course, you could have a very long debate about, but who in the healthcare system should be picking up the bill of any form of prevention, because that is, of course, a more difficult conversation. But essentially, what we see at PAL is that we have what we call an evolving business model, and it's quite necessary to have, because the business model that we have today is not necessarily the business model we will have in 1, 2, 3, 4, 5 years, when we have more evidence and we have more, that we have very concrete numbers that show what, for example, in a healthcare system or a hospital or another form of healthcare entity can save when it comes to actually implementing PAL in their system. So that is, of course, something that we're familiar with when it comes to the healthcare system, that we do need to now, and that is something we're working on, is to build up the evidence that we need to prove the actual health economic benefits of our intervention. So for now, we are focusing more on the fact that we can still keep patients at home. And we have been so far working mainly with insurance companies. So that's especially something that we're doing here, not in the UK, but in the Netherlands, where we will be working with insurance companies, because they see the benefit, of course, of being able to keep the patients at home. And here in the Netherlands, it's, of course, a little bit different than in the UK, where the healthcare system is financed through insurance. So it is a little bit different, of course. In the UK, of course, there are different considerations when it comes to the NHS and everything. But for now, insurance is a good fit for us, because there are also consumer elements to our intervention. It's not fully integrated in the healthcare system. It's still something that appeals to these families directly, even if we are, of course, working directly with GP practices and hospitals and care organizations to kind of reach the right families. It's still something that is also can be driven by families, and they see the benefit directly of it as well. So I'm pretty sure probably a lot of the health companies that you are talking to, that there is a lot of evolution in these business models, because we kind of need to work our way up and build that future where we know that we will have the evidence that just shows exactly to the euro how much money can be saved with each family, right? But for now, we're still working on that.
I actually think it's a great phrase, and it's actually a great thing to say. I think these days, I think there probably was a time in the not too distant past where saying, "Oh, we've got an evolving business model," was probably a massive red flag for any potential investors. I think now it just shows a level of maturity and appreciation for the healthcare system, and the fact that you're taking a global view, because ultimately there is no one business model here. You're not going to say, self-payers for the family, that's what we're going to lean into, because you leave so much on the table for systems. And
I mean, for any investors that only see green flags with this, they should definitely give me a call. We can talk more about it for sure. Yeah, the red flag investors, they don't have to.
No, quite exactly. Yes. I've stopped trying to convince people of value as well. I think if people see the value, they'll contact us. So in the UK then specifically, how exactly does this work? You mentioned insurers in other healthcare systems, but in the UK specifically, what are you doing and who are you doing it with?
Yeah. So now, obviously the main thing that we're working on now in the UK is that we are wanting to build up our user base and reach more families that can benefit from it. And that was also when we started out in the Netherlands, that was also the main focus. So now what we've been working with multiple GP practices and care organizations in the UK to really reach their patients and families that can benefit from PAL. And maybe something that's also important to mention is that we are not a solution that is typically introduced to families when their loved one is entering the final phase of their life, and they typically will be offered hospice care and so on. We and the GP practices that we are working with, they see the value of introducing PAL as early as possible when they are informed of a diagnosis that is life-limiting or terminal or serious in any way where they could benefit from palliative care. And this is also what is the benefit of PAL, because normally if you're in this situation, you would normally only be getting a referral to your palliative care team, or at least start to get a lot of support. That happens normally quite late in your care journey. But with PAL, because it's not really something that comes at a high cost, it's not something that takes a lot of time from the healthcare workers. It's really something that can be introduced very early, and that does mean that patient can then stay a lot more stable, like throughout that whole care journey, as they're also receiving even life prolonging treatment or other forms of treatment as well. So we are looking to find other GP practices and other care organizations, and also home care organizations that want to explore more how they can provide better care and earlier introduction of palliative care to their patients that have a life-limiting illness. Then I'm always happy to hear from them.
I do just want to call out as well. I think the just the size of the problem that you're actually solving. I don't have the numbers to my mind, but like just from my own experience of doing A&E jobs and just seeing the amount of people that will come in that, and do you know what, I've even seen it personally with like even friends of the family, as well as other things that I mentioned on this podcast, like family friends that have been in a palliative care setting at home, and they have nosebleeds and they get really bad because of those different reasons, and they slip slightly and hurt something, and the bruising gets really bad, and they break bones easily, and there's just so much that can happen. And it's as you quite rightly say, the cost of the ambulance, the cost of the A&E visit, the cost of this, the cost of that, all of that on the finance and system side, and just the very human anguish. And I honestly think there's like a metric missing that we can talk about, like in order to sort of quantify this. But whatever that is, that stress, that anxiety, that pain, that everything that those people are feeling, that number is absolutely enormous as well, let me tell you, because I'm experiencing that personally and professionally as well. The size of this problem is so enormous. And what I want to just link this to is, having looked at your website, the practicality of the information you're simply giving in your library section on your website. So the things that you're talking about there. And just to call a couple of things out here, and just to kind of show the health tech world that are listening how this really is addressing this problem and smoothing out that experience to make sure that people are at home and stay at home, and even the healthcare system that's dipping in can perform better and keep everyone where they want to be. Just some of the titles of some of these topics. Home Sweet Home, the caregiver's guide to adapting your home. Incredibly practical. 10 tips for better communication with your healthcare team. Incredibly practical. Managing pain in palliative care, addressing something that the layperson won't have knowledge of, that all of a sudden does have knowledge of. These things, and like the categories, receiving care, caregiving, planning, like this is such practical advice. And I think we can get lost when building health tech companies in the big vision. And I think the attention to detail on product here is incredibly important. I'm getting emotional to talk about this, actually. Like, ugh. Yeah, I know. Yeah. I know how valuable this will be to people. Let's just put it that way.
It just means so, like, not that your opinion as like a health tech expert matters, but I think also knowing kind of your personal experience as well. It just makes it like extra impactful for me, like to hear you say that. So like, yeah, now I'm getting a bit emotional as well. Yeah,
sorry.
it's contagious.
Yeah, I just want to say that I'm glad this exists, in all honesty, and I think anything that I can do to support this, I'm more than happy to do.
It has been a very deliberate decision to make every content piece, whether that is a written piece or if it's a video or anything else that we made, both on the website and maybe more especially in the app where we have a lot more. Because my experience was that I would have a problem and I would Google and I would try to find solutions, and I could never find anything that was written for a family member that is trying to do something practical. Like I don't want to know that it's difficult. No, I don't want to know what a nurse would do. I want to know what I can do. That was a big problem for me, and that is a big problem to all of the families that we're talking to. They just need to know, what can I do that I'm kind of allowed to do where I won't cause more harm than good. And for that reason, we've been so deliberate with everything in our library that everything is just made to be as practical and concrete and just what you can do now as possible. And we're, of course, working with all these amazing doctors and nurses and other forms of specialists that are helping us with this content when we don't work with our content partners that are letting us use their content for free. But we also make a lot of our own content, and it's just supposed to really be this practical so that they just know within 5 minutes what they can do. Yeah,
it's awesome. Listen, it's been an absolute pleasure having you on. I'm so sorry to hear about your mum and everything that you went through. I think what you've managed to turn this into is wonderful. I am genuinely so pleased that this exists in the world. And I do just think it's in a space that it's uncomfortable to talk about building a business. It's uncomfortable to talk about making revenue and profit and how you link that to impact and all the rest of it. But what I can say is I know the size of this problem. I know from a systems level that this will be making an enormous difference. And this is not one of those things where we have to go searching for the business model amidst the feeling that we're doing good. This is in that zone where there is definitely the feeling that it's doing good. You know, my emotion speaks for itself in that sense. But I also know that the business model is incredibly clear from at least when you take the broad systems view. You're absolutely right. There's always going to be a question of who actually pays for this, because if primary care pays and secondary care saves, and or vice versa, or this department does this and this department wins, and how do they, you know, all the rest of it, and is it healthcare, is it social care? The problem with budget boundaries that lives on through this, and it will do, hence you've got an evolving business model. But there's no doubt in my mind that the more people that get on board with this, the better that the world will be. And I think we will get to a place later down the line where this will be worked out in a different way potentially. This might not, it absolutely might not look like we're doing it for family members to learn this stuff. It might be that we've worked out the business model that actually at a systems level, whether it's a healthcare support worker or something that's actually then employed to be there for lots of different reasons, we might just prove the model that actually the clinical workflow looks completely different, and actually the setting looks completely different, because actually, oh, hold on a minute, family members doing all this stuff. If I needed this bit extra to do the well, why don't we put this person in there to do this? I think what you might enable for the future is incredible and incredibly useful for the space. if not only to challenge thinking, but to genuinely change the way that we do things. I think it's a very important first step on those lines. So I think it's awesome. Thank you. For people that want to learn more, what is the best way for them to either get in touch with you or to find out more about PAL?
So they can either find me on LinkedIn, just search for Nara Moripen. I'm pretty sure I'm the only one with that name there. Or you can also email me, nara@palhelps.com. And then we'll take it from there. I really would just encourage anyone who, just like what we do or in some way is interested in knowing more, you can reach out. We just want to hear from everyone.
Yeah. Awesome. Absolute pleasure, Nara. Thank you so much.
Thank you so much.